Hi, and welcome to week 4 of NUR 1000. The first thing we're going to do this week is look at the assignments that you completed for week 3 in NUR 1000. You read chapter 3 of your textbook. You had a couple of recordings here related to learning preferences, active reading, as well as some self-care information was presented. You had a discussion board about your different learning preferences. So you took that sort of assessment quiz and it helped you identify your own learning preferences. And I think that's always smart. Most people agree with what they see. Sometimes there's some students who don't. But it's important that we recognize the way we like to learn, right? A lot of your instructors will use many different methods. So maybe you're not an audio learner and lectures a part of the class. And that's all right. Hopefully they are using a variety of methods to help reinforce information. And that's something you should do when you're studying as well. So you might not be really into reading, but maybe it's important for you to, at a minimum, be skimming the chapter, highlighting important words, sort of making a general outline and figuring out what's the important content of that chapter. Then you could also listen to lecture, listen to recorded YouTube videos, and an important thing that you'll want to do as a nursing student is make sure that you actively apply your new knowledge. So taking EAQ practice questions or ATI practice questions, whatever resource you have, is really important because a lot of times students can get the basic knowledge down, but when it comes to apply it to an NCLEX style question and use clinical judgment, they can really struggle with that. Lastly, you did some practice questions, so we're going to check those out. Okay, so let's look at our first practice question from last week, week 3's assignment. So you had to read a NCLEX style question, reword the question, pick the right answer, and then tell us why you picked that answer. So the first question was, the LPN provides you with change of shift vital signs for 4 clients. Who are you going to see first? And then you have 4 different options here. This student reworded the question by saying report is given on 4 patients' vital signs. Which patient should be assessed first? Who should you assess first is fine. Who is your priority? That would be fine as well. The big thing here is the student kept the word first, or like I said, if you want to change it to priority, some other key term like that, because those types of words we're going to learn test-taking strategies for prioritization. And who are you going to see first? Who's your priority? Those are key terms that help remind you, hey, this is a prioritization question, so I can start using my prioritization test-taking strategies. This student picked A. 84-year-old man is recently admitted with pneumonia, respiratory rate of 28, and the SpO2 of 89. She said, I think A because of the ABCs. He has pneumonia, gives the vitals again. And that's exactly correct. So she's already utilizing one of the test-taking strategies for NCLEX style questions, the ABCs. So when you are figuring out who am I going to see first, one of our test-taking strategies is think ABC, airway, breathing, circulation. This patient has a respiratory issue, so that makes him a priority. Just a reminder, for these practice questions, you get the total points just for attempting them. So as long as you're doing it on time and putting forth effort, you're going to get full credit for the assignment. It's okay if you're getting some of the answers wrong. You're just starting out in nursing school and developing your nursing knowledge and your clinical judgment. So it's more of practicing these strategies versus getting every answer right. So let's look at question 2. The nurse prepares to conduct a general survey on an adult client. Which assessment is performed first? While the nurse initiates the nurse-client relationship. This student reworded it as, what assessment does the nurse perform first when initiating nurse-client relationship during the survey? So yeah, what would I do first with a client? She picked A, appearance and behavior as being the first assessment performed. Her rationale is similar to an Elsevier question, so she remembered that one. Rationale said something along the lines of when you first notice a patient appearance and their behavior before anything else, which makes sense, right? So right when we walk into a room, we're assessing the room, what's going on, if they're getting IV fluids, where things are located in the room, is it sort of disorderly, is everything in order, and how is the patient, how do they look and how are they acting? Are they sitting up and smiling at you? Are they curled up in a ball, breathing really fast? Just that first initial assessment gives us a lot of information. Question 3, the nurse is assessing a client who returned 1 hour ago from surgery for an abdominal hysterectomy. What assessment finding would require immediate follow-up? This student reworded it, the nurse is checking on a patient who had an abdominal hysterectomy an hour ago. What finding needs to be assessed ASAP? So that's great. She didn't use the word immediate, but she pulled in another keyword as soon as possible, ASAP, to help remind her that this is sort of a prioritization question. So what is gonna require immediate follow-up? She chose B, absence. Let's see, I have B as absence of vowel sounds on the abdominal assessment. But then she put as her rationale, I said B because of ABCs, respiratory rate of 8 is not safe. So this happens in real life. So her rationale, what she wanted to pick C, respiratory rate is low, which would be the correct answer, but she accidentally put the wrong letter. That happens in regular tests as well, where you fill in the wrong bubble on accident. So luckily you get full credit regardless of what you put for this one, but just be mindful, especially when taking your paper pencil exams in the classroom, that what you're putting on your bubble sheet is exactly the answer that is definitely the answer that you want to put down. But her goal answer here of respiratory rate of 8 is the correct answer. It's not a normal respiratory rate, right? You guys know your normal vitals by now. And we using that prioritization ABC, airway, breathing, respiratory concerns would be prioritized. The nurse is teaching a client how to perform testicular self-examination, which statement made by the client indicates the need for further teaching. So if you're not sure of what exactly a patient needs to do when they're doing a testicular self-examination, that's fine. A big takeaway for this one is it's saying who needs further teaching. So what you want to recognize is some of your test questions will be asking you to pick out what answer option is wrong. And students frequently get tripped up by these because you read the question initially, you're like, okay, who needs more teaching? And as you start reading your answer options, one of the answers just screams at you like, this is a correct answer. They definitely got to do this during testicular self-examination. And by default, you just pick it and keep moving on. So I recommend if you have something like this, who needs further teaching, when do you need to intervene with a student nurse or a new nurse, that if you have a paper pencil test, you actually write the word wrong to remind yourself, I'm looking for the wrong answer option. This one, what statement made by the client means that they need further teaching about performing testicular self-exam, or which of the following statements is wrong about testicular self-exam. She picked A, recognize abnormal lumps because they're really painful. I feel that some abnormal lumps may not be painful, and that's actually the correct answer, A. Question 5, the nurse is observing as the student nurse performs a respiratory assessment on the client. Which action by the student nurse requires the nurse to intervene? So same type of thing here. What's going wrong here? Her rewording was, what action by the student nurse requires the nurse to intervene during a respiratory assessment on a patient? Yeah. What's wrong about a respiratory assessment? What wouldn't we do? That type of thing. She said, if I had to guess, it'd be between A and D. I would answer D though, only because B is correct and C would not require an intervention. So she got it down to the student stands midline, position behind the client, observing the position of the spine and scapula. Nothing wrong with that one. D, the student places the palm of the hand over the intercostal space and asks the patient to say 99. That actually, there's nothing wrong with that one as well. The correct answer for this one was actually C. It's kind of nitpicky. I don't think you'll see questions like this on the test, but that says the student places the bell of the stethoscope on the anterior chest wall to auscultate breath sounds, and it's actually the diaphragm of the stethoscope that we would use. A 52-year-old is admitted with pneumonia, dyspnea, discomfort in the left chest when taking deep breaths. She's been a smoker, recently lost some weight, IV antibiotics, high protein shakes, 2 liters oxygen nasal cannula. Got her recent vitals there. O2 saturation is 94. Which vital signs reflect a positive outcome of treatment? The student reworded it, sort of giving a little scenario on which vitals show patient is improving. Select all that apply. So I agree there. So what vitals show that the patient's improving? What shows that treatment's working? What shows the patient's getting better? All those would work. She picked A, B, C, D, E. Let's look at these. So A, her original temperature was 100.2. A is 98.6, so that shows, right, an improvement, so that's a correct answer. Radial pulse, we initially had a heart rate of 112, which is high, that's abnormal. She's back in a normal range of 98, so B would be considered as well. She had B. Respiratory rate is 16, she was originally 22. Again, you should recognize that as abnormal. Now she's in a normal respiratory range, so that's great. O2 saturation was 94, now it's 96%. it's improving, getting better. We would include that one as well. BP originally was 138 over 82, and now it's 134 over 78. That one, honestly, the change isn't that big of a difference that we would include it. So correct answers here are A, B, C, and D. Which of the following clients are most at risk for tachypnea or fast respiratory rate? Select all that apply. She just left it as what clients at most risk for tachypnea. Answer options here, she chose A, B, D, and E. All but one are correct, and we'll look at them. So A, clients just submitted with 4 rib fractures. If you ever hurt, even bruised your ribs, you know that's super painful. A lot of times they do fast, shallow breaths, or because of the pain, could be breathing kind of quickly. B, a woman who is 9 months pregnant. That's correct as well. Not so much because of contractions, but just how the baby affects the diaphragm. Client who's admitted with hypothermia is an incorrect answer option. A post-op patient waking up from anesthesia is also incorrect. And this really has nothing to do with the pain, but it's more anesthesia in general. So like putting someone to sleep for a surgery is going to slow everything down. So we're worried about people breathing too slowly after surgery, initially after surgery. And then E, 3-pack per day smoker with pneumonia. That's a yes. Obviously got respiratory things going on there. So correct answers here were A, B, and E. Got a healthy adult who tells the nurse that he got his blood pressure at one of those quick machines at the mall and was alarmed because it said it was 152 over 72, and he's normally, I got a little typo there, but 114, 118 over 72, 78. The nurse gets a blood pressure and gets 116 over 76. What would account for a BP of 152 over 92? So she reworded it, gave some information, but her rewording was, why would the machine at the mall make a blood pressure higher? Or even just what can cause a falsely elevated blood pressure would be a good example of a rewording. She picked A, C, and E. Okay, let's look at these. Okay, her rationale, A, because the wrong cuff size can create an error. So we're worried about why they're getting falsely elevated BPs. A is the cuff size is too small, and that's correct. If you use too small of a cuff, blood pressure cuff, you can get a falsely elevated blood pressure reading. On the other hand, if you use too large of a cuff for a patient, you can get a falsely low BP reading. So A is correct. She did not pick B. B, arm is positioned above the level of the heart. That's correct. That would actually give you a false low blood pressure reading. She picked C. That one's actually incorrect. Slow inflation of the cuff by the machine. If the cuff's getting inflated too slowly, it can give a false low blood pressure reading. D, client didn't remove his long sleeve shirt. That has nothing to do with it. E, insufficient time between measurements. That's a correct answer as well. She said someone before him could have just had theirs and got the incorrect reading. Correct answer, not exactly the correct rationale. So what it is, like if you take a blood pressure reading and you think it's off, so you take it again right away, that can actually cause the blood pressure reading to be falsely elevated. So correct answers here are A, the cuff is too small, and E, insufficient time between reading a blood pressure, pumping up the cuff and reading it can lead to a falsely elevated blood pressure. Clients admitted for dehydration, pneumonia, shortness of breath, history of heart disease, cardiac dysrhythmias, assisted personnel reports vital signs. What do you, the nurse, have to reassess? So during report from the AP, the vitals are given. What should the nurse reassess? I think that's perfectly fine. She picked B, a radial pulse of 72 and irregular. And I would agree with that because of the irregular. The nurse would double check that one. She picked C, temporal temperature of 99.3. That honestly isn't too crazy that you would prioritize as a follow-up assessment. D, respiratory rate of 28, definitely. We recognize that as abnormal. And actually E, because if we're breathing that quickly, so fast, it doesn't always make sense that the oxygen is normal. Sometimes you will see that, but not always. So we're going to reassess B, radial pulse, as well as respiratory rate and oxygenation status. Last question, the nurse enters the hospital room of a client who had a total knee replacement the day before. Which of the following is a safety risk? Which of the following poses a safety risk? She put C, the hospital bed's in high position, definitely a safety risk. D, there's no gait at the bedside. Yes, they just had knee surgery, so we're worried about them ambulating. Also see the overbed table with the client's glasses is positioned against the wall opposite end of the bed. So they don't have their glasses next to them, which they need in order to see well.